Good morning. This is Travis County Judge Andy Brown calling to order this meeting of the Travis County Commissioners Court. It is September 28th, 2021 at 9:12 a.m. and we're meeting here at 700 Lavaca, and we have every commissioner and the judge present. So I will pass it over to the City Council, to Mayor Pro Tem Natasha Harper Madison, to call your meeting to order.
Thank you, Judge Brown. I appreciate it. I'd like to call the meeting to order, the joint meeting between the Travis County and Austin City Council at 9:13 on September 28, 2021.
Thanks. And I'll also call together the joint meeting. And do we have any callers for public comment at this time? Shelby.
Thank you, Judge. We have one caller this morning, Janice Bookout. Janice, if you can hear us, please go ahead. You have 3 minutes.
Good morning. Thank you. Thank you, everyone, for your hard work. This morning, I'll be sending you zip code level data showing in each zip code the number of months it would take at the current rate of vaccination in that zip code to get to 70 and 90% fully vaccinated in each zip code, assuming 100% eligibility. CDC recommendations suggest that outbreaks will have a more hyper-local impact and that vaccination strategies should become more and more customized in approach. I believe we're seeing this to be true. In some zip codes, it would take a year to get to 90%, and others it would only take a couple of months. As we continue to address younger people, I'd like to see data on the distribution by zip code of vaccinations for 18 and under specifically. I'm concerned, for example, that with a small number of providers able to store and deliver Pfizer, that an inequitable distribution for young people is hidden in the numbers. I would also like to point out that when you look at the data, there was a shift in May, and the percentage of doses delivered in the Eastern Crescent started increasing at a higher rate than West Austin. That's good news, and I want to underscore, as we heard last week, that that's the result of the collective efforts of many organizations who need funding to continue. Their job is in no way done. As I've heard on the collaborative calls weekly, many are running out of the extra money and volunteers necessary. They need to be able to continue, and they need to be able to pay people. The government cannot fill that gap alone, and we need many organizations trusted uniquely by each unique community they serve. I would also like to see a survey of the UT campus. The zip code level data suggests that vaccine acceptance there is very low. However, I'm wondering whether students might have gotten their vaccinations and registered at a different home address while attending remotely. We need to know what the real numbers are and if we're going to make a difference with that. So just once again, thank you so much for your work, and you'll see an email from me later today. Thanks so much.
Thanks so much, Janice. I think that's our only caller today. So we will go ahead and get started, and I'll pass it over to Dr. Walks.
Good morning, Judge. Good morning, council members and commissioners. I'll get started with my slide presentation. Can I get the first slide, please? Can everybody see the slides?
Yeah, we cannot see the slide. Is that
Yeah.
Okay.
us or no?
No, it's me. Give me one
Okay.
second, please.
Okay.
Here we go.
Thanks.
You're welcome.
Okay. You can go ahead and go to the next slide, please. Can you go to the next?
What will that next slide say?
While we're working through the technical difficulties, I'll just report to the group that yesterday APH had 314 new cases of COVID-19 reported. Our positivity rate's gone down to 8.3%. Our 7-day moving average for hospitalizations is down to 34. We have had 390 COVID patients in hospital, 162 in ICU, so we're below the 200 bed capacity limit that we initially established. And we have 108 people on life support ventilators, 25 admissions and 42 discharges. As of today, we have 1,093 people, unfortunately, who have passed as a result of COVID-related illness. And we are now moving into stage 4, which for vaccinated individuals means that they'll continue to mask in indoor settings and in settings outdoors where there is an inability to effectively social distance. They'll mask with travel and also when dining and not eating and during shopping indoors. For the unvaccinated, it's still recommended that they avoid getting out into settings where they're with people that they don't live with, and that if they do get out to dine or shop, that they would be wearing masks, and particularly doing curbside for dining and only essential shopping. So the behaviors that have been undertaken by our community to get our numbers of cases down has been effective, and the increased efforts that have been undertaken by APH and members of the county coalition and local providers has been effective in increasing our vaccinated population who are eligible for vaccine. And we are seeing the benefits of that. If you go to the next slide, please. You'll see that our curve is showing a downward trend. Our ICU numbers are trending downward, our ventilator use is going down, and our case numbers are going down. On the left-hand side of the slide, you'll see a graph. I apologize for it being small, but hopefully you'll be able to look at it later and look at the masking activity that's gone on in our county. And you'll see that with the increase in masking that occurred, started early in July and is now listed at approximately 76%. That has correlated with that drop in the number of cases that we're seeing. So masks do work to help decrease the spread. And as I mentioned earlier, our vaccine efforts and getting our population protected against COVID-19 has been helpful. Both masking and getting vaccinated have also helped those who are unprotected by vaccine, i.e. the kids that are less than 12 years old. So continuing those efforts until we are able to vaccinate all of our population is going to be important so that we can continue to hopefully see this trend downward. If you go to the next slide, please. Recent MMWR reports have shown that it's true what we're saying about schools and masking. The use of masks in schools does help decrease the number of cases and the spread of COVID-19. On the right-hand side of the slide, you'll see that we're seeing a drop in the number of cases overall in schools. There were a total of 429 cases, 375 of which were in children, primarily happening in classrooms. Whereas you remember last year, we had fewer classroom-related cases that developed. This is not true of this year because masking is not being done across the board. So we are seeing more classroom transmission, and then that's followed by transmission during athletics and after-school programs. The MMWR report showed that those classrooms and schools where masks were not worn, that there was a 3.5 times greater chance of cases developing and outbreaks in those institutions. So those measures that we've taken in the past still work, and masking, when used, is encouraged and is helpful in reducing our cases in schools. Next slide, please. Looking at the age distribution of cases, we are seeing a drop in the numbers of cases. However, we still see a higher number or percentage of cases in that 30 to 49-year-old age group. So continuing our efforts to get that initial protection with the vaccine for that age group is going to continue to be important. We're also looking to deploy boosters for those who are over age 65 and anyone under the age of 65 with chronic medical conditions to confer more protection to those groups. And of course, the immunocompromised are being encouraged to get that third shot 28 days after their second shot of the Pfizer vaccine. On the right-hand side of this slide, we're seeing the impact in the last 14 days of COVID in our pediatric population, children under the age of 18. We've had 28 cases all total, with 4 ICU admissions and 1 ventilated patient. Currently, we have 11 patients in hospital, and none of them are vaccinated. So again, protecting those children who are able to be vaccinated over the age of 12 and older is important, and continues to be one of the most important things that we can do as far as mitigating the spread of COVID-19 in our schools. And we are looking forward to announcements that we hope will be coming in the coming weeks to allow us to start vaccinating those who are under the age of 12. On the left-hand side of the slide, we'll see that the greatest increase in hospitalizations has across the board been in the 30 to 49-year-old age group, and that continues to be the case even with the numbers of cases decreasing overall. In our next slide, I'd like to show that vaccines work. We still are only seeing 1% or less of breakthrough cases. There have been a total of 771,000 plus vaccines given to fully vaccinated residents of Austin Travis County. We had 7,181 breakthrough cases. Of those cases, we were able to get in touch with 1,773. 75 of those patients were hospitalized for COVID-related reasons, and 40 of the people that developed COVID as a result of a breakthrough case unfortunately died. 21 were females, 21 were males. The average range or median age of those who died was 77 years. Of those, 14 were long-term care facility residents. So overall, the effectiveness of these vaccines has been established. It protects against infection. It does decrease hospitalizations and deaths. And so we continue to stress the importance of getting our community vaccinated. We look at the next slide. Our long-term care facilities continue to do an excellent job of protecting their residents. They're continuing to vaccinate residents in long-term care facilities. The booster's just been approved and guidance has been received to vaccinate those over 65 and those who are residing in long-term care facilities. So that will be beginning and has begun. We have now, in the last 14 days, 39 cases in our long-term care facilities. 11 of the people who were positive in our long-term care facilities were residents who were fully vaccinated. So we're continuing to see the benefit and coverage and protection with vaccine. If you look at the next slide on the numbers of fatalities that we've had, as of yesterday, there were 1,089 deaths reported. Since January 1st, we've had 517 deaths. 8.1% of the deaths that have occurred were in individuals who were fully vaccinated. With looking at race and ethnicity, 11.8% of those who died were Black, 51.5% of those who died were Hispanic, and 59.4% were males. No one who died received a third dose of vaccine. Next slide, please.
Could you please repeat that last statement? Did you say no one who died received a current dose of vaccine? I missed the word you used.
Sorry, third dose.
Thank you.
Yes, ma'am. Looking at the next slide, our Austin MSA, because of our amazing job done by our vaccine coalition team comprised of APH, the county, and also our local providers, we've been able to reach a 70% mark for those who are eligible and fully vaccinated. And it's borne out in the numbers that you see before you now. We've had a decrease in the number of cases. We've had also a decrease in the number of hospitalizations that are coming from Travis County. Last week when I last spoke with you, we had 47% of Travis County residents in our local hospitals. We're now down to 42% of Travis County residents in local hospitals. And there's an increase in the numbers of patients in local hospitals from surrounding counties. We've gone from 53% to 58%. So our efforts to vaccinate our community have been helpful. It's brought our numbers down, and we are now working to get the message out to surrounding counties to help them encourage their communities to become vaccinated as well. The next slide, please. So our call to action today is to get vaccinated if you're not protected from COVID-19. Encourage a friend to get vaccinated if you are, in fact, vaccinated. Boosters are available now, and guidance has been received to vaccinate those over 65 and those who are in long-term care facilities. For people over the age of 18 with chronic medical conditions, and people who are at risk for exposure due to their occupational or institutional setting. We ask that our community continue to support businesses that are helping us reach our goals to combat the spread of COVID-19. We're continuing to encourage masking indoors and in places where you're unable to socially distance effectively. And we're asking that those who are unprotected and unvaccinated remain in safety of avoiding crowds, and if they do have to go out in public, that they wear masks. We're asking those who are sick to stay home, get tested, see a healthcare provider, and if they're eligible for referral for monoclonal antibody therapy, that they ask their healthcare provider for that referral. And with that, I'll end my presentation and pass it on to Director Stirrup. Thank you.
Thanks.
All right, good morning.
Morning.
Hopefully I can get my mic to work better than my ability to share the screen. And so to start off, just to refresh everyone's memory, if you're sick, get tested. If you're exposed to someone who tested positive, get tested. And if you're not sure, get tested. We are still supporting testing operations at the locations listed here on your screen. Um, if you need in-home testing or access to mobile testing, you can make those appointments by calling 512-972-5560 or by calling 311. Over our last operational period, we administered 1,488 tests. So now taking a look at vaccine, we have a lot to celebrate this week. It's a good lesson in delayed gratification and doing what's hard and seeing the payoff. The fact that we're in stage 4 and we can see for our county, we're at 81% first dose and 71% fully vaccinated. In comparison to other major metros, we continue to be a leader in this effort. And so my thanks to the staff and the community for working together along with our partners to reach these very important goals. When we look at vaccinations by week in Travis County, again, we're seeing the slight drop off, but that's to be expected. The teams will continue to do the good work. So far, over 1.6 million vaccines or doses have been delivered in Austin and Travis County. For our last operational period, APH delivered over 1,000 doses. Cumulative for APH and community care, we've delivered 463,265 doses. When we look at the number of residents who have yet to receive their second dose, we see this number continues to go down. A couple of weeks ago, we were at 250,000. Right now, we're at 212. And so the work of the teams continue to have a significant impact. When we look at our county and see how vaccines are being received or given out, we see that pharmacy still remains to be the largest provider, with public health and government coming in as a close second. When we look at our distribution data for Travis County, broken out by race and ethnicity, the team thought it would be helpful to present this information in a little more viewer-friendly format rather than the chart. So when you look over to the left and you see the vaccination status by race, you can see that while we're overall doing well as a county, those gaps still persist in our Hispanic and Black communities, where only 35% of our Black population is fully vaccinated and 48% of our Hispanic population is fully vaccinated versus 63% of our white population and an 80% of Asian. When we look at the vaccination rates by race and ethnicity over time, we do see that even though the gaps for Hispanic and Black communities persist, that we are making progress. I love the way that the different colors show the changes week over week, and we can see those incremental changes more clearly. And so where do we keep up the good work? This is where we'll be this week. As a reminder, all of our clinics are walk-up, no appointments are needed. We do acknowledge that if you choose to pre-register online, your appointment will go a little bit faster. There is no ID required. You can come visit us at the Southeast Library, at Little Walnut Creek Library, and the Pflugerville Library. We will also be at the Delco Activity Center, a site that we stood up in anticipation for booster shots, and also at IDA Bluff Springs. For our mobile operations, we'll be in 21 different locations this week, including 3 ACC campuses, front steps, the Travis County Adult Probation, and we will continue to make home visits. We have first and second doses available, as well as third doses for those who are immunocompromised. And third doses are for those folks, again, being immunocompromised, if you are undergoing chemotherapy, if you have rheumatoid arthritis, if you've received an organ transplant, or any other medical condition which makes your immune system need that extra oomph to protect you, well, that's what the third dose is for. We also have boosters available for Pfizer. And so let's talk about boosters. A lot of comments or news media over the weekend about the authorization of booster shots. And so this is what we know, that the FDA provided emergency use authorization recommendations last week, and the CDC advisory panel on immunizations reviewed the FDA recommendations to give us the guidelines for boosters. And so for folks who have been fully vaccinated for at least 6 months and are 65 years and older, 18 through 64 at a high risk for severe COVID-19, or 18 through 64 at a high risk of occupational exposure. And this is not an all-inclusive list of the occupations identified as high risk, but we see first responders, we see our educators, food and agricultural workers, manufacturing workers, corrections, postal workers, transit, and grocery store workers. So anyone from 18 to 64 who works one of those jobs is eligible for a booster. At this time, there are no booster recommendations for Moderna or Johnson & Johnson, only for those who have received the Pfizer vaccine. And so I believe it was in May, City Council passed a resolution directing the staff to build on the capital area COVID-19 vaccine distribution plan to develop a comprehensive COVID-19 vaccine booster shot strategy. That should include analyzing lessons learned from the initial vaccine rollout with a focus on combating hesitancy or access issues, building on communication and partnership with community, government partners, and other vaccine providers during the booster shot process, plan to execute a strategy while continuing to address ongoing issues with vaccine and prioritizing those populations that are experiencing disparate outcomes, a communication strategy and plans to educate the public with accurate information on the booster shot process and where residents can get the vaccine, and plans to utilize community health workers and other community partners to address booster shot outreach efforts. And so the staff facilitated some sessions with an outside contractor to really see how we can build on the initial framework of the plan. And so just to give everyone an update of that initial plan that we've been using since last December, the purpose of the capital area plan is to provide an externally facing document that outlines our strategy, to make sure everyone has a level of awareness and transparency about APH's plans to meet needs, to have a level of transparency about resources and partnerships available. The caller talked about community organizations and small projects running out of money. And that's something, you know, as a city department, we have to keep a high level on resources and what's feasible and practical and what's the most efficient use of what we have available, whether it be funding or staff or facilities. The plan is organized and supports the structure developed by the CDC and is used by state and local health departments nationwide. So it's not something that we just came up with, even though we're pretty cool and smart at Austin Public Health. We're following what we're seeing our partners do nationally. It describes our outreach, engagement, and communication strategies. As a public health department, we are always in a process of continuous quality improvement, and that's demonstrated in this plan and reinforced by the directives in the resolution, where we always consider lessons learned and make improvements to the services that we're providing. It provides a strategy for third doses and boosters. And we're also beginning to think about what it's going to look like when pediatric vaccines are available. And so although this skeleton plan is constantly reviewed and analyzed, we take feedback that we get from everywhere, from these bodies, from Facebook, from partners, from clients, to make sure that we're constantly evaluating our process. About 2 Fridays ago, we had a formal meeting with our vaccine coalition that included local health authorities from neighboring counties, as well as grassroots organizations, representatives from the healthcare field here in Travis County. And we will continue to have more events in October to really get that community feedback to make sure that we've captured all of the pain points and victories from our initial rollout and take those into consideration as we develop our plan for not only boosters, and it looks like those will be subsequent phases as we wait for Moderna and J&J for decisions to be made about that, but also for pediatric vaccines. And so we've broken down our initial lessons learned into 3 categories. And so the first was health communications, and speaking to the resolution and also what we know is important as a public health department, because that's where we live. We live to address those disparities and focus on overall community health. And so really having health communications that are focused on communities at risk. And so we want that to be a two-way process. As much as possible. And so that involves us making sure that we're keeping the community informed on the latest science, rules, regulations regarding testing and vaccine. It means that we will work to provide ongoing outreach with this updated and revised information across all of the domains of the response. And that proved challenging for us the first time. There were some issues with being able to have that reach. We recognize that social media was an area of opportunity for reaching Travis County residents, and we were continually challenged by the need to have focused, linguistically and culturally not only appropriate but relevant messaging to disproportionately impacted communities to make sure that people were receiving information in a manner that was most comfortable to them and allowed them to make those really personal choices about vaccine. Um, and so then we talk about health equity. And you know, I chuckle to myself because, you know, COVID really is doing a great job of pointing out the systemic gaps that we have, not only locally, but nationwide. And so what we saw is that this pandemic just exacerbated conditions um, that we see in our community. We all know about the Eastern Crescent and the issues that we have with food access and chronic disease, and COVID was right there. Um, and so the lesson learned from that is, you know, building on what we know to do as a public health department when we're addressing those issues, making sure that health equity is an integral part of all of our operations, from the front end to the back end, not only what people see when they roll up to a vaccine site, but also the systems and the infrastructure that we put in place. Um, we recognize that we need a renewed health equity focus to concentrate on the needs of those who are economically marginalized, on areas with high case positivity and areas of low vaccine uptake. And you kind of see that play out when we are coupling vaccine with food distribution, or, you know, when our WIC and neighborhood centers are sharing information about, first it was testing and now about vaccine. Um, Having a renewed focus to be inclusive of all races, ethnicities, and languages, being reflective not only in our media presence, but in our staffing, making sure that our technology supports um, as many languages as possible. These things will be key. And then having that renewed focus on providing outreach through trusted sources at the neighborhood level. And that is through our community health workers, which we have some on staff. We got some new positions in budget. We're going to hire those folks, train them up, send them out. But it also means those investments that we've made in different community organizations that we know have the ear, sometimes better than we do, in those communities that we are trying to reach. And so making sure that we're leveraging those relationships and supporting them to be able to do this work. And then the biggest bear, our IT. Looking back, our infrastructure was built to handle daily operations, but not pandemic operations. And as the pandemic unfolded, it was difficult for our IT infrastructure to meet the demands. It had to, be user friendly. It had to be culturally relevant. It had to be linguistically appropriate, and it had to be able to spit out data that policymakers needed to be able to make policy and resource decisions. Um, and so, with the ongoing pandemic rather, we had to prioritize and move quickly with our vendors for implementation. And if you've ever worked with anyone on setting up an IT system, like that is hats off to the team who really did that work to set up the use case studies, to make the adjustments, to be as responsive as humanly possible to the growing needs. And from that, we've thought about how we prepare our infrastructure not only for this response but for future responses. Um, and that really has to be a structure that not only meets the programmatic needs, but disaster related response requirements as well. And all that is good, right? But then we also have to recognize that we do have sections of our community that don't have the same access or savvy when it comes to technology. And we realized pretty quickly on the front end of this pandemic that the over reliance on technology had some unintended consequences in those very communities that we were trying to prioritize. And so, how quickly being able as a department, using our internal resources, our partnerships with Austin Energy and 311, and a great partnership with the county to figure out a phone line so that those residents who didn't have good Wi-Fi, who didn't like the internet, or just couldn't plain figure it out, could call and talk to someone. So whether you called 311 or whether you called the equity line, midway through, we were able to increase that access to our residents. And so when we think about all that we've managed to accomplish and all of the things that we know we need to put in place, back to the callers' comments about the dwindling resources towards these efforts, the longer that this plays out. And so some things that we heard loud and clear that we're still working on as a staff to address in our plan, incentives. We continue to see in other populations how incentives work. Um, Although boosters are very important, and as a health department, we stand ready to provide a booster shot to anyone who has received a Pfizer vaccine 6 months ago. Our focus needs to be on that initial protection for the community. And so making sure that we can support booster operations, but keep that focus on protecting folks, getting that initial layer of protection in place. And so we've done a lot of research about what peer cities in Texas have done for incentives. And it's more than just buying gift cards. The most sophisticated systems for incentive programs have IT infrastructure and staff to back that up. So those are areas of opportunity that we will continue to explore as a department and to figure out how we can leverage existing funds as well as some incoming grant dollars to address some of these gaps. How we increase neighborhood level outreach and education. The 9 community health workers that we received in the budget process will be hard at work beating these streets. That is a good resource that we will mobilize rather quickly when we talk about not only boosters, but anything related to COVID vaccine, because we see that is working. We see that the work that the collaborative continues to do works, and we want to be able to model and build off of those efforts in Austin Public Health as well. And then we have to think about security for existing and new operations. We stood up Delco in anticipation of a large rush of folks coming in for boosters, and it's okay that we don't have that yet as a community. It is a resource that we will continue to support. It stands ready. We know as a community, we were mostly Moderna. Out of the 460 something thousand shots that I talked about earlier, only 5,841 of those were Pfizer in terms of the shots delivered by Austin Public Health. That doesn't mean that we will not, again, anyone who comes to our site, we will give them their booster shot. What it does mean, though, for the community, and it's important to note that while you won't need an appointment and you won't need any identification, we will need you to bring your vaccine card, because we will not have record, we may not rather have record of your Pfizer dose if you've gotten it from someplace else. And what we found is that the data that is in MTRAC, which is the, you know, what we all feed up into, is not always accurate and up to date. And so we really encourage our residents to make sure when they show up to any of our locations to get their Pfizer booster shot, that they have their vaccine card with them so that we can verify not only that you're in the right time period, but you've received the right dose. Going back to the unmet needs, in the height of the pandemic response through the Emergency Operations Center, we had access to traffic control and logistical support because the city was really shut down and there wasn't anything that's happening. And now that we've opened back up and we're in our festival season and people are out and about and enjoying life, there's a strain on those resources. And so it's a balance of finding out how our sister departments can help in that effort, but how we can also leverage relationships with contracted vendors. And then just the ongoing logistical and financial support. Well, the logistical support from EOC, from a high level of coordination, helping us in public health roll out not only vaccine and testing, but ACS and the other services that we're managing in relation to response. And so I'm sure there'll be plenty of questions about booster, but that is kind of our update on the plan. The high points again, knowing that equity needs to continue to be the focus, how we shift from an over-reliance on technology while building out that technology to meet the needs of the populations of focus, and how we mobilize or continue to mobilize boots on the ground teams to provide that place-based support that seems to be working in helping us move the needle in those communities. And examples of such, just to share some updates on our community outreach. This week we'll be out at Foundation and Communities, we'll be at the St. James Baptist Church, and we'll also be at the Beauty and Barbers Convention. You'd be surprised about how much information is shared in a barbershop or a beauty salon. Personally, when I go visit, I take the opportunity to drop some knowledge on the ladies. If they have questions about vaccine, they know that's kind of what I do. And I use that space to help encourage folks to make good decisions for themselves. And there's our team out at a Cap Metro event talking about supporting our public transportation workers. Always love to see the photos. When we talk about, again, making sure that it's a connected approach that addresses needs across families, being out at the Del Valley Opportunity Center, you know, up until last week, Austin Public Health was supporting the county collaborative by providing persons to give shots. They've taken over those operations, and we're still there because we know that, you know, that community not only needs vaccines, but, you know, food security continues to be important. We talk about asking people to wear a mask, and if I have to make a choice of buying some ground beef for my family or this pack a mask, I'm probably going to buy the ground beef. And so, having hand sanitizer available, having the PPE kits available, and just to run down some stats that the staff nicely plopped in here, we served just under 400 families with the PPE bags and the masks and the hand sanitizer. We gave out 201 resource bags. Um, and those were really neat. It had food items, items for pets, books for kids, and those were provided by our neighborhood services unit. We gave away 6 pallets of household goods that were provided by our partners at the Central Texas Food Bank, 714 boxes of shelf-stable food, and 622 boxes of fresh fruits and vegetables. So all in all, I think that's a great day. You got your basic need met, and then you walk across the way and you get your vaccine. And when we talk about messaging, again, being out there and making sure that we're focused all the way over to the right. You see the images that are reflective of our Let's Stick Together campaign. And that's available in multiple languages, as you can see there. Moving over to the left, mask up, lather up, sleeve up, and are really reminding people in an easy way the things that we want you to do to stay protected. Mask up, wear your mask, lather up, wash your hands, sleeve up, get your COVID shot. And right now, we are also encouraging folks to get flu. 2 shots, 2 arms. Get it done. The family photos here in Spanish. And then, sometimes we need the gravity of the situation to smack us in the face. And that graphic all the way over to the left shows up the number of unvaccinated individuals that died due to COVID-19. Again, reiterating Dr. Walks's point visually that vaccines may not prevent you from getting a mild case of COVID, but they have shown up strong to prevent death from COVID. And with that, that is the end of my report. I turn it back over to the judge. Thank you for your time this morning.
Thanks so much, Director Stirrup. I'll turn it over to Chuck Brotherton and Constable Morales and Chief Bailey.
Good morning, Judge, Mayor Pro Tem, Court and Council. Chuck Brotherton. I am the Travis County Executive for Emergency Services, here to give y'all a brief update on the activities of our vaccination collaborative over the last week. I'm hopeful that you can see my slides at this point.
Yes.
And you can see on our first slide that over the past week, the number of doses that were given out in the last week by the county collaborative is down somewhat from previous weeks. 781 was the total through this past Sunday, the 26th, while our strike team numbers are continuing to be, to track week in and week out. We saw a drop off in demand over the weekend. We had excellent weather Friday, Saturday, and Sunday in town. Of course, we had a football game at UT on Saturday. It seems that people were finding a lot of different things to do this past weekend than come out and get a shot. Regardless, we are there. We will continue being at the Expo Center, and we will continue going out into the community every day of the week, mostly in the evenings, to do shots with our strike teams. Our total number of shots delivered to date by the collaborative, starting from January of this year through this past weekend, I add that up at 105,076 total doses, a mix of first and second, with just a handful of third doses in there. That was a lot of the initial work was, of course, at Circuit of the Americas, when we were seeing gigantic demand at our drive-through. Giving you a little more information on the zip codes that we continue working in the Eastern Crescent, Monday through Saturday, actually through Sunday of this week. Monday, fairly light day, but then on Tuesday, you can see that our numbers continue maintaining with good turnout at the various locations where we appear. Wednesday, Thursday, Friday, and then Saturday, you can see again, while we were at Expo, we were also in various other locations, and the numbers were fairly light for both Saturday and Sunday. Always want to show our viewers where they can find information. Can you see that particular screen? On the county's website, on our landing page, all you have to do is click here to quickly find vaccination information for any day of the week. Tuesday, September 28th, you can see all of the different activities happening today. These are a mix of both public and private, but we've got information for example, community care at Rosewood, Zaragoza. Click on that and you will see the kind of vaccine being delivered, hours of operation, and so forth. On Tuesdays, we appear at the 4 JD's markets throughout the area, and then going through Wednesday, Thursday, Friday, and so on. On the City of Austin's landing page, likewise.
I'm sorry, we can't actually see that screen.
Okay,
right
I
now.
apologize. I was wondering if y'all could see that screen.
I can see the screen for some reason.
Is it showing up at the city?
It sounds like the city can't.
I don't see it on
It's
the
not showing
web.
on the screen or on mine either.
Okay, I'm going to stop sharing and then reshare. We're working in WebEx. I'm more used to working in Microsoft Teams, but this is where we are. I'm hopeful you can see that. There's the City of Austin homepage. I was
Yes,
showing
that's
y'all the Travis County homepage, City of Austin homepage, where to get vaccinated, and then of course vaccines.gov also for private vaccination providers. Find a COVID vaccine in your area. For example, 78653 is a zip code. Set the search radius to 5 miles and search for vaccines. You can see that this illustrates why it's important that we, both Austin Public Health and the County Collaborative, continue working in the Eastern Crescent. One major reason is that the commercial pharmacies simply are not available in many of the zip codes in this part of our county. So, going to stop sharing now.
Chuck, would you mind showing just real quick that map that y'all did? I thought that was helpful, flipping through that if people couldn't see that previously, the one with the red dots.
Absolutely.
You're able to share that in the same way.
The one with the red dots, that would be our collaborative.
Yeah.
Okay. Yeah, and it looks like I have to stop sharing and then reshare. So here it is, Judge. Can you see that?
Yes.
Okay, so these are our various locations where we appear throughout the week in the various zip codes. And the numbers in each dot indicate the number of shots delivered on that particular day. So these are the locations, Judge, Mayor Pro Tem, Board of Council, where we will continue working on our strike teams. We are in the process of renewing our county contract with Ascension Seton. The other partners that we work with consistently are the Texas Army Guard and, of course, Austin Public Health. But we do recognize the need for us to continue our efforts. We are also working on a plan to assist our independent school districts, primarily in the Eastern Crescent, at the point where we have an emergency use authorization to administer vaccinations to children under 12. And we meet weekly with the ISD superintendents, and we do want to work closely with them to have a plan in place at the point where we can begin scheduling more strike team visits in schools to meet the need and the demand for vaccinations for kids. At this time, I will stop sharing. Judge, turn it back over to you for questions. Actually, forgive me, Judge. I want to turn it over to Constable Morales for an update from Precinct 4. Constable.
Thank you.
Morning, Commissioners, Judge, Council members, and Mayor. We continue to focus on outreach and education, doing the work to ensure that our strike teams and our collaborative and our partners are successful. Our mobile vaccine teams have gave out a combined 781 shots this past 7 days, with a total of 3,868 for this month. We handed out a total of 2,800 flyers with an additional 893 phone calls to the target areas. We will still continue to target areas in the 78758-2441 Del Valley, Austin Colony, and of course 78744. We will continue working with ISD targeting Title I schools that are in highly affected zip codes. This week we'll be at Langford, Cook Elementary, and of course the Del Valley Opportunity Center and Daly Middle School in the Del Valley community. We want to thank a couple of our partners this week, especially with our community leaders, Constable Alan Ballesteros, Commissioner Trevilian, Councilmember Rudy Mateer for being our host this weekend, or this past weekend and this past week in the Pflugerville community. Also, this week we're looking at some unique stuff this week. We will be going into the village of the Cordovas this week. It's a public housing community, along with the Jamaicas that are set for this weekend. One important Jamaica is San Jose Catholic Church. Of course, the two independent school districts that we work with. One focuses Langford Elementary School and Cook Elementary School. So far, we did an amazing job this week because, again, we knew that the weather had a lot of play with us coming into this weekend, but we stayed focused and continued to go out there and kind of pushed our agenda more effectively to where people could understand, even if we had to show up at sites, local grocery stores, and just hand out the information to educate these people about the vaccine. One important thing is Judge Andy Brown set up a clinic for us at the Pipe Fitters Union, and we were super impressed because we had a lot of people take the shot that were from our local Austin area and surrounding areas, so we were excited about that. I'll turn this back over to you.
Thanks, Constable. Thanks, Chuck. We'll go through I've got a couple questions for you, Constable, but we'll wait till my turn. So we'll do it as normal. We'll go through the commissioners and then me, and then we'll go through the city council members and the mayor pro tem for questions. And we'll start off with
Judge, your audio cut out right there. You said we would start off with.
Is the video working? I'll bet it's working.
Video is working, and we can hear y'all again, Judge.
Excellent.
We can hear the court.
Okay, cool, thanks. So I'm going to recognize Commissioner Margaret Gomez.
Well, thanks so much. But I continue to be impressed with the efforts that we're all making, continuing to make, and trying to find new places to go to try to convince people to get vaccinated. I hope the weather doesn't hold us up this week, because obviously we need the rain, but we'll still try to make every effort to reach as many people as possible. So, but thanks very much for all of the efforts that people are making. And I am beginning to hear some folks saying that they will get their shot. So I guess we just kind of need to be at the right place at the right time for them to be able to do that. But I really appreciate it for everybody's efforts. Thanks so much.
Commissioner Shea?
Thanks, Judge. My usual gratitude to all of the staff and the employees and the volunteers that are helping to try and keep our community safer. And I continue to be horrified that our state leaders are suing school districts that are just trying to keep their kids safe. And I wanted to ask what further information we might have about this. There was a story on the front page of the Statesman this Sunday, and the headline said, "Fewer cases in districts with mask mandates." And it went on to say the Austin School District, which was the first in the area to require face coverings in defiance of Governor Greg Abbott's executive order banning districts from mandating masks, has reported the fewest cases per 1,000 people, 10.4, among the districts analyzed by the Statesman. And I don't know all the school districts they analyzed, but I'd like any information or guidance that you can give us about this issue, because it just seems like reckless endangerment that the governor is trying to prevent school districts from protecting children. I'm assuming your data will correspond with what the Statesman found, and there was a graph that said, I think, school children who wore masks were 3.5 times less likely to get infection. I'm not recalling
Yes.
exactly how that.
Yeah. Yes, ma'am. That 3.5 times less likely to have cases and outbreaks. And yes, we're continuing to support our ISDs in their planning and efforts to implement measures to protect children. And it's a difficult time because of the climate that we find ourselves in.
Can you just remind us the very specific data about the outbreak of COVID in schools in our coverage area, in Travis County area, and the number of hospitalizations?
Sure. So the current number of cases in schools is 429. 375 of those are student cases.
And that's with infections, and then the numbers in hospital?
And currently in hospital, there are 11 pediatric cases.
And I know there was.
And none of those are vaccinated.
They're all unvaccinated. Well,
Yes, and 2 are in ICU and 1 is on a ventilator.
Thank you.
Thank you, ma'am.
Commissioner Trevelyan?
Okay. I also want to thank the team for the hard work and consistent work that has been done. My question is more along the lines of, how are we collecting lessons learned in real time? And what I mean by that is, we had the original outbreak and steps were taken to address the spread. But then we had a Delta variant, and then the numbers exploded again. I imagine that we can expect another variant at some point. And my question is, what are we doing to capture lessons learned so we can do a better job of creating systems rather than transactions? How are we extending our reach into hard-to-reach communities? And are we building any training opportunities so people who are interested in the healthcare field can find their way to training so that they can assist in this outreach effort?
So that's a multi-layered question, and I'll start. I think, I know, throughout the response, we have received unfettered feedback from clients, whether on the spot or through our social media platforms or people sending us emails. So that's as real time as it can get. We've had several iterations of surveys. Sendero has done their survey at least 3 times. I know that the county, the APH team jumped on the county collaborative efforts of the on-the-spot vaccine surveys that they were giving out to folks after they got shot. So that's in real time. And we'll continue to do that. Like every opportunity that we have to ask someone about their experience, or to when the education teams and the CHWs are out in the field talking to folks about vaccine, we're recording that information. And I will say one of the other unmet needs that team daylighted for me was that if they're out there in the field, and these are the educators and the CHWs, and they get that person to be vaccinated, then they have to like direct them to a shot, and how great it would be if they could have a vaccinator with them. But there's just not enough nursing pool to staff all of those positions that we would need. Out in the field, you would need an RN level person to administer a shot. And so that's something that we're working through. So that process of collecting real-time data continues. When you talk about how we build up our public health workforce, so there's one opportunity that we already have in play with the Central Texas Allied Health Institute, where through a workforce development grant from Austin Public Health, we are supporting that program. And the next level of conversation is how we create an externship program similar to what we have with ACC or UT School of Nursing, to have those students work with us in the field, either at one of our clinics or with our strike teams, to get that real-time exposure. We're also thinking about ways that we can expand our AmeriCorps program to expose students to careers in public health. And so there's a strong program that we have with local high schools that are also underway, and kids have the opportunity, students rather, have an opportunity to do rotations through the different divisions in Austin Public Health so that they have that level of experience. I think there needs to be some conversations about the long range plan, like how do we build that out as a community? But those are some of the places where, as a city and a department, where we're trying to have that impact. And if there was a third point to your question, it went there. If you want to refresh me on what that was, sir.
No, I think you hit most of the points. I'm interested in making sure that we build training opportunities. And then I'm particularly interested in how we build some of those opportunities in hard to reach communities. For example, LBJ has a science emphasis. They don't have the Science Academy anymore, but the curriculum should be designed to help students find their way into science related curriculum. And I'm just trying to look at all the touch points to make sure that we are communicating regularly with some of those people in communities that could be helpful in reaching some of our hard to reach neighborhoods. So I think that you answered the question, but thank you.
Thank you. Commissioner Howard?
Thank you. I had the chance to meet one of the students working with Dr. Thomas Hockaday this weekend, and I was glad to see the pipeline happening. Maybe all too small, but I was glad to see it. I just wanted to thank everybody for the hard work. As Commissioner Gomez said, we're not finished. We have to keep offering shots and just keep it up. I really appreciate the work. And I just wanted to say thank you and just appreciate Interim Director Adrian Stirrup. I think you have stepped into a position and you're just doing an amazing job communicating. And I'm so glad to know you. You're doing a great job. Thank you, Adrian.
Thank you, Commissioner Howard. I appreciate that.
Thanks. Hey, so my question is, so if we get the authorization, which sounds like we will very soon, to start giving shots to kids who are under 12 and I guess between 5 and 11, seems like that will do a couple of things. One, it's going to shift the percentage of our population that is vaccinated instead of our eligible population. So that number will drop. And I'm curious kind of on two fronts. I guess have we looked at like if we get the similar percentage, like 60% of kids who are 5 to 11 vaccinated, where would our overall rate be? Is that an easy question? Either Dr. Wilkes or Dr. Stirrup, have y'all looked at that? Like, would our overall rate be, if our overall rate right now of the full population is 61%, according to the New York Times, would vaccinating a similar percentage of kids 5 to 11 bring us up to 70% overall, or do we know, is that not something y'all have looked at yet? If I'm making
I haven't done that particular calculation, but I will, sir. I believe that would take us well over, but I'm not sure.
Great. And then Constable Morales, I know you and I and Chuck and the ISD superintendent spoke a little bit yesterday about a possible way to start planning for vaccinating kids, mainly in elementary schools in the Eastern Crescent of Travis County in particular. Could you just to sort of start that conversation, would you mind saying a little bit about what your plans are there?
Sure, Judge. Our team has started working in the last month and a half, almost 2 months, on targeting Title I schools and schools in the Eastern Crescent that are highly affected by COVID. As you see right now, we are currently do that. I did invite John Lawler, who worked on a skeleton with me, and I'd like to let him give a little bit more input on the direction we're going there.
Good morning, y'all. I don't know if you can hear me or see me.
Yep, both.
Awesome, great. Well, thank you, Constable, and thank you, Commissioners, Judge, Mayor, and Council. Just to give a quick update on what the Constable was laying out, we've been looking at the full amount of schools that we would need to set up clinics in both Title I schools and then also school districts in the Eastern Crescent. Right now, with our existing clinical capacity that we've slowly been increasing, which big shout out to Ascension Seed and the clinical providers at the County Collaborative. We've been able to increase our clinical capacity, which means that when we get the word that we can provide pediatric vaccinations 5 through 12, we could, if we needed to and wanted to, go out and take on one specific school district over the course of a week, provide a vaccine clinic once, twice, 3 times at each of those school communities in 1 week. Similarly, we would keep up our grocery store campaigns. The grocery store locations, a lot of times when we have a vaccine clinic at a Title I school, we'll actually see some of those families come in for their second dose at one of those grocery store locations because it's more convenient in time and location for that follow-up. So it would be a bifurcated approach, keeping up our consistent presence at these neighborhood hubs, while at the same time trying to put as much as we could into trying to provide as much access immediately to those Title I schools and school districts.
Excellent. That sounds great. So if I understand it correctly, and we talked to the superintendent of Del Valle ISD and several others that I think were interested in us working together. So basically the first week we try our best to vaccinate the elementary schools in Del Valle as best we can and see, and then from there what we learn to go to the other Title I schools like you talked about. Is that more or less the plan or the theory, I guess, Constable or John?
Yes, Judge. That's going to be kind of the theory of it, but we are still doing at least 2 Title I schools a week, along with 2 additional hubs, so that stays static there. So we're doing 4 schools. We'll use Del Valle for an example. You have 8 schools. We are capable of doing all 8 schools within that week, multiple schools a day, to include AISD schools that are in the Title I areas. I think. Again, just looking forward, you heard Director Stirrup say, and she hits great points about resources and the need out there. We're definitely going to have to make sure that if it happened tomorrow, we're ready. But if it prolongs us as far as resources go, we need to be looking at that here in the near future.
Yeah, thanks, Constable. And we'll talk maybe more about that in the Commissioner's Court part, but I do understand that y'all are getting stretched thin. You've been doing great work over this entire period. So it's a conversation we're going to need to have. Thank you very much. And I'll pass it over to you. Mayor, are you back in the cell?
I'm back, but I'm going to need to leave again here shortly. So I'll let the Mayor Pro Tem take the helm here. And I think we start with District 1.
Okay.
Thank you. I appreciate it. So my question is whether or not there are any, given that it's flu season, and I have bumped into a couple of folks who've gotten the flu so far, and for the sake of full disclosure, I haven't felt great the last couple days, but my COVID test came back negative. I know this is a conversation about COVID-19, but I can't help but wonder if there's an opportunity for us to offer flu vaccines alongside COVID-19 vaccines at some of these events. Is that an option?
For Austin Public Health, we are planning to push flu in wherever possible when we're given COVID-19. We're riding with that tagline, 2 shots, 2 arms. And so wherever we can maximize the opportunity to protect the community from both COVID and flu, we are doing so.
And just to offer some folks a little bit of clarity, my office has received a few questions about how old you can be to get the flu shot. We saw somewhere that you could be 6 months old and receive vaccine for flu. Is that accurate?
Yes, ma'am.
Thank you very much.
Okay, I'm going to ask my question real fast because I won't be here through the end of this, and I appreciate that opportunity. Dr. Walks, would you talk about the percentage of people in our local hospitals that are from outside of Travis County? I raise that just because the vaccination rate seems to vary by county. Are we seeing any of that reflected in our hospitals?
Yes, we're starting to see a higher percentage of people from outside Travis County being hospitalized in our hospitals now. And they're primarily coming from those areas where there are lower vaccination rates.
I raise that issue only because we talk about the disparity we see in schools as it relates to infections, also impacts counties and obviously the people in our hospitals. Do you know about what the percentage is of people in our hospitals locally here that are coming from out of county?
Right now, it's 58%.
From out of county.
Yes, sir.
And I mention that again because as we're looking for, we're coming down on staffing level on the occupancy in our ICUs and hospitals, which is really good, still high, and we're still strained. And now that we're acting more and more of a regional resource, I hope that the legislature, when it's distributing the $16 billion in support money, I hope they take a look at that and help us and cities like us with the staffing in hospitals and support, because we really are performing a regional role at this point.
Definitely, yeah.
Thank you. Councilmember Fuentes.
Thank you. And thank you for today's presentation. I especially appreciate the update on the resolution, the booster shot strategy resolution that Austin City Council passed a couple months ago. I think today's presentation was a really good and thorough update, super informative. And so Director Stirrup, I really appreciate the presentation. And I think, I wanted to share that part of the reason why I brought forth that policy was, I think we all stand united in wanting to send a clear message to our constituents that we will deliver a booster shot strategy that is rooted in equity and that builds upon the lessons learned. And I appreciate that in your presentation this morning, you went through in detail the lessons learned on how the initial vaccine rollout happened and how we can improve. For many in our community, especially in my community in District 2, there is a significant mistrust in public institutions. And so I think, us having a plan, a livable, breathing document, so to speak, that we can change and update and tweak as we now move towards this next phase of the vaccination. And I really appreciate that we had this presentation jointly, because as Travis County elected officials and City Council elected officials, it's important that we are all on the same page as we move to this next phase of the vaccine. And we've seen even just in the last few days how fluid it is with the FDA approvals and the CDC guidelines. So I think, having an information campaign that's really rooted in sharing the details of who's eligible to receive the booster, why it's important, the science behind it, and getting that information out there as clearly as possible is going to be imperative. And so I want to thank you all for your hard work, your life-saving work in helping us with this vaccine distribution. My question today is, knowing that booster shots are now available, the Pfizer booster shots are now available for certain individuals. What does the city plan on doing to mitigate capacity concerns on how we still have communities that are struggling to reach that 70% fully vaccinated. That's great that that's our county number, but we know that there are certain pockets in our county that are not at 70%, some that are not close to 70%. And so how will we continue to achieve that? We're addressing vaccine hesitancy to get people to take the first shot. You mentioned that the incentives were one area that were successful in our outreach and one that you recommend moving forward, but there are some capacity concerns and resources needed. So if you wouldn't mind, Director Stirrups, just touching on what more can we be doing on that front to ensure that we're still centering outreach to our most vulnerable communities.
Thank you, Council Member Fuentes. And so, yeah, to be clear, our focus will be on making sure that our community has that initial layer of protection. And so boosters are important, but we are not at a point where we have to make a decision about what operations to support. And so, as I said, Delco was added as an additional site. We had really good traction there for the initial vaccine, and we bought that online to help any overflow that might happen with the booster allocation. I think the fact that this is going to be a phased approach will help us with that, as we know that our community was largely a Moderna community for the majority of last year. And that slide that I showed, the breakdown of where folks are getting their doses, is important for the context, because now we see with the availability and more providers online, a lot of people are choosing pharmacy, which frees us up to act in that capacity to make sure that we're focusing on the population so we can be clear about what our strategies are. So one, to get that initial layer of protection. Can't stop, won't stop. We will continue our boots on the ground efforts to be in those places and spaces where the map is still not lighting up green, to make sure that we're getting those initial layers of protection out to community. And the fact that the booster shots can be rolled into those operations. It's not like you have to choose. You can get them out from our mobile vaccine team, or you can get them from one of our static locations. So I think one of the greatest improvements that we managed to make was to enable that walk-up process where people didn't have to go online and wait for hours and wait for a spot to become available. The fact that that barrier has been eliminated, I think, gives us the flexibility and the capacity to focus on the initial protection and make sure that we're making boosters available as well. Where it's feasible, looking at the targeted occupations, if we're sending strike teams out, let's say to a Cap Metro event, making sure that we have enough doses to not only do initial shots, but if anyone's there who feels like they want that booster shot, to make sure that we're doing that double duty. And so, as the constable pointed out, we're not at a point where resources are an issue. Through the purchasing process, we are securing some more incentives. Those incentives will not be for the booster program. Again, sticking to our primary focus of that initial layer of protection. So that incentive program will be geared towards getting first and second doses in play. But I thank you for your question. We just wanted to highlight those things so that if we get to a point where we're having to choose to operations, this body won't be surprised, and we can give some guidance about whatever decisions need to be made about resources. But we're in a good space right now.
And Council Member Judge, if I may just add to that, the County Collaborative likewise is operationally ready to begin delivering boosters. We have capacity at the Travis County Expo Center, where we are doing drive-through vaccinations every weekend. We have space there to add additional lanes. We have staffing resources. We will cooperate with Austin Public Health as well to bring in any necessary resources if we see demand begin to spike for the booster shot, as well as for vaccinating those under 12. So Austin Public Health is the county health authority. Their plan for boosters is essentially our plan, and we are ready and able to plug right into that and make sure that we can get shots out to the public.
Thank you. That's great to hear. And I really appreciate the targeted and focused approach, especially in our Eastern Crescent. As you showed us today with the data that pharmacies are a top source for getting the vaccines in general. Well, for many in our community, especially mine in District 2, we don't have a freestanding standalone pharmacy east of 35 south of Ben White. In fact, the first one is being built right now. And so knowing the unique role that public health department plays in that rollout and that outreach is critical. So I'm really heartened to hear your feedback and your comments today. Thank you.
Councilmember Renteria.
Thank you, Mayor. And I really want to thank all the staff, especially to George Morales, my constable from Precinct 4, George Morales. You know, you have done an excellent job. You know, I see the numbers of Hispanic shots and that your team have administered, and it's just amazing. You know, and I really want to thank you. But I'm still concerned that you know, our numbers are still low. Is that when we're quoting the Hispanic vaccination totals, is that including the whole county, or is that the city of Austin?
Council member, the numbers that the county collaborative is reporting are for the county collaborative. So those are the numbers essentially that we are delivering in Travis County.
So are our numbers of vaccination on our minorities, are they higher? If we separate the city from the county, would our numbers increase?
I'd have to take a look at that. Our focus has been to look at the data for the county, but I can ask the team to do that. Intuitively, I think it would appear that we were doing well just because of the fact that we've pushed our Black and brown communities out either north to Pflugerville or south to the Eastern Crescent. So,
yes. Yeah, I'm very curious to see if our effort in the city has really, if the numbers are really that higher than what's being reported. So I would like to see that. And for the people out there, you know, I'm a senior. I have great grandkids, and it would kill me not to be able to be around them and hug them and all that. So I took the booster shot, and I had no side effects. I mean, period, nothing. I just a sore arm for that day, and that's it. So I encourage everyone to take one when it becomes available. And 3 days later, I took the flu shot. So you know, that's even more important. And then a week later, I took the shingle shot. So my arms are pretty shot up now. But anyway, it has no side effect. It's just a sore arm because you got a needle stuck in your arm. And that's it, you know. And now, I mean, I can go anywhere I want to and hug anybody I want. So still with my mask on, but I'm not afraid to do anything like that anymore. So I encourage everyone to take that vaccine shot. It's the most important thing. And you're doing it for your family, you know, and your friends, and for all of Austin. So please go out there and get your vaccination shot. Thank you, Mayor.
I'm going to recognize Councilmember Kassar and Mayor Pro Tem. I'm going to probably leave during Greg's questions, so if you take over, that'd be great. I'll try to get back on my phone. Councilmember Kassar.
Thank you, Mayor. Thank you, Councilmember Renteria, for being a model for everyone. And I do want to double down on your thanks to the Travis County strike teams. Thanks, Mr. Lawler and Constable Morales, and for all just the really hard work. And Mr. Brotherton, I thought that the map showing where those were on each day was really helpful. So it's just clearly really targeted to where you need it, and it's something that we have here in Travis County that I think lots of people across the country would envy. So thank you all again for your work. I have a question about data. You know, when you show the vaccinations by race and ethnicity, there's just so many people in the other category, thousands and thousands of people in that category. And while I'm sure, and we know that we have too few of folks in communities of color and districts like mine with equal amounts of vaccine, we know that the number is too low. it's hard to know what the real number is because there's so many thousands of people in the other category. Do we have any data or information or inkling about the breakdown of people that are marking other? Do we have which zip codes they live in, or just anything so that we can get a better sense of, it's just hard to look at the chart and really have an accurate picture because there's so many people in that category.
I can ask the team if we can pull that information out somehow for the county-wide data. I think it would be easier for folks who are in our EHR system that we vaccinated to pull out that data, but it would only be a small sampling, but perhaps it would give you some indication of what the larger picture is. And it really just comes down to how people choose to identify and how the systems reconcile people who choose multi-race or multi-ethnicity. So, and every system seems to track it differently. We were having this conversation internally about how we wanted to expand the options for our patients, but then how do we chew that up to the way that the state is reporting out data? So the short of it is, I can see if we can pull that for APH patients and see what we can do about drilling down into the county data to get that detail for you.
That would be great, because if what we find is it's a lot of folks that are multiracial or biracial, that could be very interesting. Or if it's folks that just aren't marking race or ethnicity, that might tell us something else. Or if it's heavily Eastern Crescent, that might tell us something. But if it's not, that might say something else. So I appreciate that work. And thank you, Director Stirrup, for presenting to us sort of what the resource needs might be, because that'll be really relevant to the city and the county here. So thank you.
Excuse me. I don't know that I see Councilmember Kitchen, in which case we'll go to District 6. I saw Councilmember Kelly earlier.
Yes, thank you so much. I appreciate that. I've been having problems with my computer. So I was wondering, and thank you so much for this great presentation today, Austin Public Health. You guys always knock it out of the park. I'm wondering how close you all will be working with ACL to ensure the safety there. And maybe if you could enlighten us and tell us what the plan is for that, the 2 weekends where the festival is happening.
I was watching Dr. Walks's hand. Do you wanna start
Sure.
and then I'll jump in
Sure.
after you? Yeah.
Sure, we've been in conversation with the organizers and discussing mitigation efforts. They are planning to require a negative test prior to the entry to the festival grounds within 72 hours. And if they do not have the test, they will accept proof of vaccination as for an entry to the grounds. They will also be requiring masking in areas where masking is not possible. So where people are gathering in queues and on transportation vehicles to and from parking areas. They also have on-site medical facilities to handle minor issues that might occur as people are participating in that concert festival in the next 2 weekends.
Thank you. And then just as a follow-up, how will you all be tracking? Let's say somebody gets COVID. I know people are coming and going from out of town. Will it make it more difficult for you all to kind of see who may have been exposed to COVID?
We will have ongoing disease surveillance teams that will continue to reach out to do contact tracing, and we'll be monitoring to see which people report that they were participants at ACL.
Okay, great. Thank you.
Thank you.
Councilmember Poole.
Thanks, Mayor Pro Tem. I just wanted to share a little bit of bouncing off of what Councilmember Kelly just asked about people in from out of town and a music festival and so forth. I was fortunate enough to go to the Big Barn Dance in Taos, New Mexico, right after Labor Day, which Will and I enjoy going every year. We weren't able to go last year, so we were determined to go this year. And I want you to know that to get our tickets, we had to show proof of vaccination. The city of Taos had set up a free testing site right at the entry for anybody who wanted to take a test. And as a result of that trip there and back again, and some other activities that Will and I have been out of town for as fully vaccinated adults in our society, in particular in cities like New York City, as well as Taos, New Mexico, we remain negative. We both did the test, have done that multiple times, and it's clear evidence that the vaccines work. I may just be one person, but I'm a good profile demographically, and I just wanted to encourage everybody. It provides a level of comfort and assurance and certainty to you and your family and your friends and your kids to go out and get that vaccination. And the travel is not, it went fine. Everybody wore masks on the airplanes, and we were very compliant, obviously, members of society, Will and I. But with regard to ACL, I hope and trust that the protocols that will be put in place will be strong, and they will be, I know they are thoughtful, and I fully anticipate that everybody who attends that festival will do so with civic responsibility and their responsibility to the greater community top of mind, so that when we come out of ACL, we don't see 2 weeks later a surge. And that would be my anticipation and my hope. And so thanks to everybody who's, again, going above and beyond every single darn day on this situation. I really appreciate it. And those of us who have remained negative and have done what we needed to do, we all appreciate your work. Thanks.
Thank you for sharing that, Councilmember Poole. Councilmember Ellis?
Thank you, Mayor Pro Tem. I have a question, as it looks like we're getting close to vaccinations being approved for the 5 to 11 age group. What efforts are being made either between schools or churches or festivals that are geared toward children to try to bring the vaccines to them? Do you know if those conversations are happening kind of between all these different entities to try to make it fun for the smaller ones to get excited about getting a shot finally?
I was all ready to answer until you said make it fun. I'm not
Make
sure
it fun
that
for the kids.
I'm not sure we've done that, but throughout this process, we've had strike teams that continue to work with ISDs, charter schools, and private schools, focusing on Del Valle, Manor, Pflugerville, and those schools in AISD. And those will continue once we get the approval for the PD vaccines. We already have the strike team assembled. Those resources are identified, so it's not like we're going to have to rush out and find the nurses that have that special skill set. In the past, we have had fun events like Boo the Flu is one that we do around the October timeframe to encourage kids and families to get a vaccine. And so we won't get the authorization for the kiddos in time to incorporate the COVID shots with Boo the Flu. But there are plans in place to try to make it as accessible as possible while keeping folks safe as well. We don't want to create a situation where someone comes out to a festival and then is exposed. So all of those things are being taken into consideration. But I think at the core, the relationship with the kids, or with the schools rather, and then having those nurses that are skilled in giving shots to kiddos is key. And we have that in place because we know nursing resources are hard pressed to find in our community. But then there are also a lot of great partners that have been to our events and specialized in the PD vaccines when we used to take a loved one to a doctor in September around this time where we're trying to get kids to come be fully protected. So all that to say is that we have the resources in place and those connections that we can leverage once we get that full approval.
I appreciate that, and I didn't mean to insinuate you would create events for people to go to on the fly, but I know there may just be some school events or church events that are happening. I was fortunate to be able to attend a football game last Friday. Councilmember Tobo was also there. And so I just know there may be situations where younger siblings aren't going, the family's already going, people are around. And so it just may be helpful to think about if there's any connections to be made to help, a pharmacy be able to go to a football game, or to kind of create those connections, just to make it as simple as possible on families so they don't need to add one more into an already busy life.
Councilmember Tovo.
Thank you, Mayor Pro Tem, and thanks to all our staff for all of their work and all of their presentations. Just on that last point, I know that the Austin Public Health is working with groups like the Thinkery to brainstorm what kind of partnerships might be available to do just what you've suggested, Councilmember Ellis, kind of make it more fun. My personal advice is lots of lollipops. I find that still works, even with my teens who really need one when we're getting a vaccine. I had a question. I'm not seeing in today's backup the map of vaccination status, and wondered if you could point us to where that is on the web. In particular, I wanted to follow up on a question that Ms. Bookout raised and that we've talked about in previous conversations about if you can offer us any specific information about the work that you're doing with UT to either get data about students who have been vaccinated outside of the county, or continuing to increase the vaccination status of those students who are in West Campus.
So I'll speak about the maps if Dr. Walks, you want to take the data question. And so every week when we put together the presentation, we try to highlight the critical pieces and be respectful of the time constraints. And I know that there's a busy work day for both bodies. And so because there was no significant change in the map, we decided not to show them this week, but we can post them to our website and definitely send them to your office. They were prepared, but pulled because no relevant change. UT, oh, yes. And we continue to support UT in their efforts. I know that Dr. Young reports out on the Wednesday calls, and I will check with staff if there's specific data about the students. I see Dr. Walks reaching for her mute button. Maybe she has a more specific update for that.
So we do know that UT has a robust vaccine program and an incentive program for vaccinations for students on campus. There were communications sent out to students to encourage them and to notify them that there was an expectation that people would take advantage of being vaccinated prior to coming to campus. And now there's an ongoing effort to give that opportunity to those who were not able to get the vaccination before they return back to campus. With regards to statistics, I've asked that question and have been told that there are 90% probably in the athletics arena, and I don't have a figure for the population at large, and anticipate that that's something that we won't have reported out to us at this point while they're doing that ongoing vaccination process. But I'll ask the question and see if I can get more information for you for next time.
That would be helpful. I know it comes up probably every other session that we have, either from the community or from, I think Commissioner Howard asked it last time. I've asked it a few times. So if there are any specifics that you can offer, that would be great, especially since it is an area, if the map hasn't changed, it is one of those areas that at least the data we have reflects is not as fully vaccinated as some other areas of the city. And so I know that I believe in one of our sessions, Austin Public Health indicated that you were maybe doing some mobile access, some mobile outreach in that area. But if the more specifics we can get about either the work that APH is doing or the work that UT is doing or any of that data, that would be helpful so that we're as apprised as possible of status. in that area. And
The other thing,
as I've offered in the past, my office stands ready to assist in those efforts. It's just not, it sounds as if there's quite a bit of work going in and we want to be supportive and not duplicative.
and the other thing that I might also add is that they do extensive testing in that area, and their positivity rate is low, both for symptomatic and surveillance testing. So because vaccine status is not something that we can request and require that students produce, they are essentially ensuring that the COVID spread is contained by doing contact tracing and also by doing a lot of testing. So we do have eyes on it. We just don't have an answer to that question about vaccine, unfortunately.
And the staff just indicated that it may be due to a reporting gap into MTRAC, so we can chase that down to see if that's the issue there.
Thanks very much.
Councilmember Alter?
Good morning. I don't have any questions this morning. Just want to encourage folks to get their flu shots. My whole family has ours. And it's just really, really important that we don't tax our hospitals anymore, that we need to. The flu that's going around is nasty and you don't want it. So just please do get your flu shots if you haven't already. And a lot of the places where you can get a vaccine, you can get flu shot. It's very easy. Thank you.
Thank you for that reminder. And just before I turn it back over to you, Judge, one thing I just want to put on the radar for our professionals in this department is, as we enter Breast Cancer Awareness Month, I would love to be able to have that additional conversation with you all about opportunities around having our community just make an additional investment in protecting vulnerable populations of people. But I'll definitely address that with you all off the record. Judge, I'll send it back in your direction.
Thank you very much, Mayor Pro Tem. Can y'all hear me? Okay. So we will, thanks everybody for all your efforts on this and keeping going. Obviously, it's not over yet, even though the numbers are going in a good direction right now. We're definitely not out of the woods. I will go ahead and adjourn the Travis County Commissioners Court. We'll come back at 11:05 a.m. and then I'll pass it over to the Mayor Pro Tem to do the same with the City Council.
Thank you, Judge. I appreciate that. I'll follow your lead, and at 11 o'clock, I'll adjourn the joint meeting between the Travis County and Council. I'm going to need at least 15 minutes, colleagues. Hopefully, everybody's comfortable with taking that long before we come back and start our work session. I don't see any objections, in which case we'll go ahead and adjourn, and I'll see y'all at 11:15. Thank you,
Thanks, y'all.
everybody.
I got you, babe. I got you. I got you, babe. I got you. I got you, babe. I got you. I got you. I got you. I got you. No, I got you.